This Medical Minute sponsored by Avera.
Multiple sclerosis, or MS, is a lifelong condition that affects nearly 1 million Americans.
In today's Avera Medical Minute, Alexander Todd speaks with a neurology specialist to learn more about diagnoses and treatment.
What exactly is MS?
So multiple sclerosis is an autoimmune disease that your body sends immune cells to attack the covering of the nerves in the brain and the spinal cord. It can flare up somewhat unpredictably, and it can basically affect any part of the nervous system. So it can cause a large variety of symptoms.
And are there ways to cure or just to handle the symptoms?
Yes. So when there is an MS flare, there's some inflammation going on in the brain or the spinal cord, and we usually use pretty high dose steroids for a few days, either orally or IV. To help tamp those symptoms down. And then there are medications that help prevent these MS flares in the long run. They're more longer-term medications.
Is there a specific thing that maybe starts MS in someone's body? Is there something that we could possibly prevent it from happening?
As of right now, we don't think, we haven't found that anyway. There are certain risk factors, younger people, more women than men, and actually the farther north you go in the world, there's a little more risk of MS. But in preventing it, we don't know exactly. People that have a family member with MS, if they're on high doses of vitamin D, that is a little bit preventative because that is a little bit of a MS risk too. But preventing the first flare, we don't exactly have that figured out quite yet.
And do the symptoms typically show up later in life? Is there kind of an age mark?
So no, actually, the symptoms typically show up in like the 20s, 30s, 40s maybe. And it can be very focal symptoms, and focal meaning like just your arm goes numb or isn't working, or there's some double vision, or even like color vision changes. Sometimes sensory, like tingling types of things, numbness can happen too. But they do actually usually happen earlier in life. 20s, 30s, 40s. And it's this flare that kind of develops those symptoms over the course of a day or two, and then they stick around for a while. But then they do eventually get better for most people.
Well, that's good to know at least. Well, you mentioned handling the symptoms of the flares. Are there any other treatment options someone could consider?
Yes, so there are pills, IV medications that are either every day or every few months, even for some of the IVs, that help kind of modulate the immune system. It doesn't necessarily turn it off. It's not like a drug that we use for transplants or anything, but it just kind of modulates the immune system a little bit to prevent it from acting too much and causing damage to the brain.
For more information on MS and treatment options, head on over to avera.org/medicalminute. We will be right back.